It's time for the Half Hour to Health with Dr. Bob and Debbie DeMaria. Call a friend or family member now and let them benefit from today's exciting and informative program. If you want to lead a healthier life, the time is now.
Hello, this is Dr. Bob and Kason DeMaria with another Half Off Health for you, and I'm going to tell you tonight, if you're sitting on the couch anywhere in the world, because we show these on the internet, you're going to want to make an appointment to come to CLE, that's Cleveland, Ohio, and find us, because we are the answer you've been praying for. I have been so blessed over my career to have written several books, and this happens to be my favorite one, Dr. Bob's Drugless Guide to Balancing Female Hormones. And do you want to know why? Because women are bombarded with toxins every day that impact their health. Let me just share this one nugget with you and we'll continue on with our guest. What really hurts my heart is when I have someone that's in their late 30s or early 40s that's had a procedure done called ablation. Ablation is when you have the inside of your uterus cauterized. Can you imagine that? Cauterized. Because of heavy menstrual flow. The part that I can't figure out is nobody ever asks you why you have the heavy flow. You have the heavy flow because you have too much estrogen in your body and your body is not able to process it. So before, and I don't care where you're at in the world, you could be in Bangladesh right now, before you let anybody do a procedure to you, it'd be worth a trip to come and visit us. We're here to make a difference in your life. And with that, I'm going to introduce someone who took and made the decision to come to see us. Ursula.
Yes.
Thank you. Thank you for coming to see us at North Coast Chiropractic. It's going to be a great segment tonight. And I know there are people all over the world waiting with bated breath to find out what happened to you. So let's start the story. You watched us on TV.
Correct.
Talk to me about that. What did you learn from TV? What made you decide to come in to see us?
Well, I seen you and your wife on TV one time, and I liked the half hour to health because it included the whole person. It wasn't just chiropractic, but it had like the health tips and what to eat, what not to eat, and especially about the sugar. So it made sense to me. So I kept, watching it for a while, and I would have came sooner. I thought, oh, this would be really something I should check out, but I thought, no, it's too far to drive.
So that's going to be my next question. How far do you drive to come to see us?
I drive 60 miles now.
One way?
One way.
So I would have to say congratulations, and we thank you first for the confidence that you have in us, because, I know that there are people watching us that think, gosh, because I've had people don't want to drive 10 miles.
Yeah.
And we talk to people at different events throughout the world that will say to us, I wish I lived close to you. So even 60 miles for some people is really close. So you came in, talked to us and myself and Dr. Kason about what was your experience like? Because, Dr. Kason is an excellent chiropractor. She's a female chiropractor. That's in a man's world today, and we are blessed to have her in our office. So talk to us about even your relationship with Dr. Kason, because you've had prior chiropractic care.
Yes, I have. But actually, I think your office is awesome. You walk in there and it's just everybody's so friendly, and she is extremely awesome because she explains everything as you go along, and it just makes the adjustments and you feel 100% better when you leave.
Tell us about your previous chiropractic care, how it's different than now, because some people at home right now maybe have never been to a chiropractor, or maybe they are going to a chiropractor currently, but they aren't seeing the results that they want to achieve for their optimal health.
Well, I've had some good chiropractic experience, but it never included the whole body. It didn't include like your emotions, or if you didn't feel good or anything. It was just basically the adjustment for whatever, and those were okay. But I think coming to your office, when I got there, I wasn't really feeling at my best. I had just had my physical and everything was okay, but I still didn't feel good.
So that's interesting. So when you went to the Western healthcare provider,
correct,
according to their checkoff list, you passed.
I passed, but I knew I didn't feel good. So when I seen you again on TV, I thought I really need to go there.
You think the Lord was talking to you, saying,
I think
Ursula?
So. Yeah, absolutely. I think He's always there, that still voice. But if it wouldn't have been for the for the long trip, I probably would have been there sooner, but I thought, no, it's too far, and I thought, oh, maybe there could be something nearby me. But anyways, I came, and I never regretted it. It's been really good. I made some adjustments in the way I eat a little bit, and I just feel 100% better, and I've only been there 3 months.
You know, Dr. Kaysen, we took posture pictures of Ursula, and we did a thermography.
They were bad.
So do you want to, let's just debrief, because see, we do some unique technology in our office. Actually, I like to divide the United States in half, and the Mississippi is the midpoint. I like to believe east of the Mississippi River, we have probably one of the most unique practices in America.
Yeah, you do, and you have like state-of-the-art equipment, which is really good too, so you can see.
Want to talk about the thermography?
Yeah.
Sure. When Ursula, when she first came in, we did a thermography, which is a temperature scan of your spine. So just like taking your temperature, your regular temperature, it's just like that, but of your back. So what we did was we have this device and we roll it up your spine, and it's a snapshot picture of how your nervous system is adapting to the environment, which you want it to be adapting at all times to all different circumstances. So that was pretty interesting for you to see exactly. We were able to show you just with the colors, the red and the blue, and you could really see where your nervous system was not adapting. It's like CSI.
Right, it was interesting.
And I just want to throw something out there, because we've had patients that have come into the office that we've done the thermography along the spine. Wait till I tell you this. And if they're taking certain medications like antidepressants, and I'm not telling you to get off your antidepressants, but it skews the results. So that means we have had patients that will run the temperatures like really off, and we've had people we've done it 2 or 3 times. That's fascinating.
Especially even with women on birth control and medications, which is really common, or even having a history of birth control and medications, you do the scan and it just doesn't come up, because what's happening are the medications are really masking the symptoms and what your body is trying to express.
Wow.
You know, we take some unique x-rays. You want to go over the x-ray aspect, because Dr. Kaysen and Dr. Anthony have been trained, and they have really fed into my life so much with a technique we call motion-specific films that we can pinpoint. Do you want to go into the detail of that?
So in our office, what we do is we do specific motion x-rays. So you may have had x-rays done before if you've went for a physical or exam, or even in a previous chiropractor's office, but those are usually static x-rays, so you're not moving. So you might have had those previously, Ursula, where you just stand still, but you never live life without having motion. So in our office, what we do is specific x-rays where we're able to see exactly what's moving and what's not moving. So we know the proper mechanics of how things should be moving, but they're not. So what we do are we do flexion extension views. So we'll have you tuck your chin and also extend your neck looking up to the ceiling to see the proper motion of that spine. So it's really interesting when we show you in your report what it should look like, and then we show you what your films are. So you're able just to see exactly where these specific segments are locked and choking the spinal cord.
So what's unique about your situation is that we adjust you exactly what your spine tells us. So, you know, I think what's important, because so many people have had a prior chiropractic experience, and I think it's awesome that you're seeing a chiropractor. But I know that your chiropractic experience was a little bit different before, because I'm not sure if you had films that were shown to you. Can you talk about that just a bit?
You know, it's been a while back. I've probably seen the x-rays up on the wall, but I think, that might have been it. No, it wasn't like the films that I seen in your office, because I was like, when I seen that, I'm going, oh my gosh. It was really eye-opening too, because especially my spine, and then just even the way I was standing and the way my head was, I could see. I mean, you didn't have to tell me, I could tell after I looked at those pictures. But it really confirmed what I already knew that was wrong with me, so it wasn't, I just didn't know why.
Well, I think what's also important, we take posture pictures literally with a digital camera. And we actually have an app that we'll use sometimes also, is that most people, and what I want you to do is I want you to become interactive. We're going to take a short break here in a few minutes. I'd like you to hurry into a part of your home with your family, even be better. Everybody should close their eyes. Literally do this, and you take your head backwards and forward. You can do it left and right. and then open up your eyes and objectively look and see. What happened to Ursula is that you might be brushing your teeth and shaving and combing your hair, but you never really look at yourself.
Right.
So what happened to Ursula when we were showing you her picture was kind of like, whoa, you were really off.
I was.
But I think also what's is really important is the type of adjustments that we do in our office is that we provide adjustments to correct your posture. So how your posture is how your spine is. So Dr. Kaysen was saying, we improve spinal function.
Sure, you do.
Let me ask you a couple other questions about how has it impacted your life, your chiropractic experience at our office?
Well, I sleep better. I eat a little bit better. Actually, a lot better. I do my ABCs, and didn't really think that would go together with the red beads, but it's actually really good, I think. So, and I try to, I exercise a little bit more again, and just the adjustment, especially I think it was maybe the second one with this with the stretch, what do you call it, the traction. That really was amazing because it was so weird. You know, I've never had anything like this before, but the results were amazing.
When you say the word weird, we don't want people to get the wrong idea. Don't take that personal.
No.
What we do is we put our patient's spine in the position of improvement.
Right.
And so part of what we do is that we do cervical traction in the office, not over the head, but literally restoring that curve, and then over time we make that available for our patients to use at home. So how have you enjoyed your experience at the office as far as our team and being when you come into the office? What has that experience been like?
It's amazing. It's amazing because everybody is friendly, everybody's upbeat, everybody's helpful. If you need anything, you know, if you can't just find it, it's just let me get it for you. It's like, you know, it's really, really, it's a very good experience. You feel at home. And then even the other people that are there for chiropractic adjustments, they talk amongst each other, they kid around, they have a little word for the day. It's amazing. It's just amazing.
Well, what's unique about our chiropractic practice is it is a well-being wellness practice. We do our spinal adjustments in the open. So there are people literally watching us worldwide right now. This is your moment. What would you say to someone that's been sitting on a couch, rather it be in Cleveland, Ohio, or Ravenna, or Mansfield, and you drive 60 miles one way?
Right.
Talk to them.
They should just go.
Why should they go?
They should just go because it's just the whole person wellness. It's for the whole. It's for your whole person. It's not just. It's your back, which I think those adjustments have really helped me because I feel better. My back doesn't hurt, you know, like it used to, and I have more flexibility already. I eat better, so I have more energy. Just overall, I think it's just worth the trip because you don't get that if you just go to the doctor and he prescribes you something, and I just don't like to take pharmaceuticals, so that's my biggest thing. I just don't like it. So when, you know, I rather would take a supplement or a vitamin or something that can do the same thing for me. So, and I think, and overall, I feel good.
Ursula, first, I want to personally thank you. I know that Dr. Case and Dr. Anthony do the same. Now, you may be watching this literally anywhere in the world right now, and you just do not know what to do. You may have had pain, digestive distress, headaches, sinuses. I don't really care. But if you're not happy with the services that you're receiving, whatever those services are, we would love to be a part of your life. We would love to have you be on a segment because we're here to make a difference in your life. We're going to take a short break, and we'll be right back. Hello, this is Dr. Bob, Anthony, and Kaysen DeMaria, and I'd like to invite you to join us at our office. We are here to make a difference in your life. We will listen to you. We will listen to every complaint you have and help you make wise choices for your long-term health problems.
I just want to invite everyone to bring their kids into our office because we have so much fun and we know how we can make a difference in impacting not only the kids but also your family, just helping them reach that optimal level of function.
And one of the things that we're blessed to use is some advanced technology with how we go about your care. So we're able to do special thermal imaging of your spine and do motion x-rays And we're also just able to use some biocommunication devices in order to figure out the best plan of care for your specific case.
So what's going on in our particular practice is that we have high-end technology. We've been skilled, trained, and experienced. We will listen to you. We know that you want wellness. We look at the whole package. We look at the whole person, regardless of whatever you've had done to this point, whether it be surgery, you're on medications. Give us an opportunity to serve you. We have taken care of this area for over 35 years, and we have the expertise to make a difference for you and your family. We have educational material that's available to you. We have material that's available in the form of books and technology. So we'd encourage you, regardless of what you have going on, that you give our office a call today. Let us make a difference for you and your family. And we're also available to speak at your business, your organization, or your church. We love treating families. We love chronic problems. Give us a call today. You'll be glad you did. Hello, this is Dr. Bob, Anthony, and Kason DeMaria with another Half Off Health for you. And I'll tell you what, if you did not get an opportunity to watch the first part of the segment, you just tuned in, we will have this posted at some point. You're going to want to watch the program with Ursula because, you know, she suffered for a long time. And she came into our office and her skin is vibrant. She's vibrant. We know that when people come into our office, just like some of you sitting on the couch right now, you're tired and depressed, and you've been thinking, man, I just got to do something different. Well, we would like to invite you to come into our office. We have what, Ursula was our ideal patient. She comes in, she's happy, she follows through, she's doing what we tell her to do. We're here to make it, we don't accept everybody that comes into our office. I had a patient who came in last week that he had an idea what he wanted to do in his mind to get better, and he's never been better, and unless he changes, guess what? He'll never get better. So we just released him to find somebody else to take care of him. So just because you call Dr. Bob, Anthony, and Kason up doesn't mean that we're going to be able to help you, or there are certain principles or rules you have to follow. They're not Dr. Bob, Anthony, or Kason's rules. What temperature does water freeze at? 32 degrees. We can't change that. Gravity never takes a vacation. She had a lot of epiphanies.
She sure did. It was really good watching what they were talking about because there was some really great points that are in there. And when Ursula was talking about why she enjoyed coming to the office so much, she said, you know, for overall we're looking at a different picture because when we're talking about what chiropractic care is and lifestyle changes, we work on a model that is describing physically what's going on in her spine and her nervous system, chemically what she's putting in her body, whether it be foods, makeup, anything that's in the environment that's affecting her, and then also emotionally, the stress and emotional baggage that she's carrying on a regular basis. And all three of those things, physical, chemical, and emotional, affect her overall well-being. So she was saying is when you look at those components, physical, chemical, and emotional, and address them all together, it makes an impact in her overall health. And I think that there was a lot of really important nuggets that were in there, you know, like she went and had a physical at her traditional Western medicine type of physical, and they said that everything was normal. And I know that when we're in the office and the things that someone might think is normal aren't in our normal range, you know, when people aren't going to the bathroom or they're not sleeping well at night and they aren't having the optimal life that they would enjoy, you know, we know that that's not normal. It's not normal to have a headache every day. It's not normal to have a heavy menstrual flow. So instead of resulting with the problems and being more of a sick care model, we're very proactive when it comes to taking care of your health. It's an investment into your health for yourself and your family. And I know that we made a significant impact in Ursula's life.
You know, I'm kind of chuckling to myself because people use the word common cold. Common cold. It is not common in our life. So Dr. Kason, I know that you and I have impacted her the most because we seem to be the ones that have treated her the most. What has been your experience with some of these ladies that have had other chiropractic care, and you know you're doing adjustments to them, and how would you explain to someone who may have had prior chiropractic care that what we do is so unique? Because she was impacted by you.
It's interesting with a lot of these women in the office. It just kind of, you know, it hurts my heart to think that, you know, these especially young women, that they didn't know the difference, what not to do, because maybe their mom told them, they heard it from somewhere else, they might have read it from a magazine that this is how to get healthier, to promote health or wellness. And then they realize, they have an epiphany almost around like 30 or 40, and then that's when their body, they're starting to actually have these light bulb moments that things might not be going the way that they said they were going to be going, or that they've been trying all these years to promote health, but it's not working. So especially with Ursula, when she first came in, she was happy and excited and just had this bubbly personality, but after her first adjustment, I mean, that vibrance in her, she just lit up even more from what she really was. And then just learning her story about the emotional component of her losing her mom and what she was going through with stress and 2 jobs, and her just talking about how in the morning she wakes up at 3 in the morning to go to work and to get ready, which most people, they think, wow, 8 o'clock in the morning, that's getting up really early. So just being able to educate women and everyone in the office, even that have had previous chiropractic care, I think we take a different approach. And I think what's important for all these people is just, prior to what they already know, just kind of look at it with a new perspective, because we have something different to offer. And
You know, it's kind of interesting because she does work 2 jobs. I mean, that's 2 jobs, and she wakes up at, there's some people going to bed at 3 o'clock in the morning. And she's made some lifestyle changes. I just want to throw out a couple thoughts here. There's so many things that we can talk to you about today. And you know, Dr. Bob's ABCs are just so important. I have Dr. Bob's ABCs every day, even on Sunday. And I might travel. When we travel, I know this might sound really eccentric, but I'll take beets with me in a container. And say, Dr. Bob, can you really do that? They just become a part of your life. And, you know, we cook them anyways. And if I'm going to go to a salad bar and they have ginger beets that might be old or out of a can, I figure, you know what? What's the big deal? You take some beets, you take other things. You know, people buy soda pops and bags of chips. So this is a red apple. And you say, of course it's a red apple. Well, we know that it's better and more beneficial to eat a half a red apple every day, because a part of my training is I have a degree in natural health. And I took classes on Ayurvedic or Indian medicine or Asian Indian medicine. And a part of Indian medicine or Ayurvedic medicine is about promoting digestion. So you live and die in the gut. So if you've not pooped, because if you don't poop, you have to poop 2 or 3 times a day. Say, I haven't pooped in a week. We have people that haven't. It's because you're probably not drinking enough water or eating enough vegetables. So this half a red apple, and one of the side benefits, it'll lower your cholesterol 13%. Very significant. This is the equivalent of what a beet would be in your body. Now, for all of you right now that have high cholesterol, you can lower your cholesterol up to 40% by eating 15 grams of beet fiber. And I know that recently some of the famous healthcare providers that are on TV have talked about cholesterol. We've always talked about cholesterol as a basic building block. But I can tell you that if your cholesterol is over 250, you've